you want to also measure the pulmonary capillary wedge pressure, because in cardiogenic pulmonary edema, the pulmonary capillary wedge pressure is elevated, but in non-cardiogenic pulmonary edema, the pulmonary capillary wedge pressure is normal. So these are the things you want to start looking at in a question stem to help you to tell, is this cardiogenic pulmonary edema or non-cardiogenic pulmonary edema? So we've been talking about pulmonary capillary wedge pressure, pulmonary capillary wedge pressure, pulmonary capillary wedge pressure. What does it mean? It is the pressure inside the left side of the heart, especially the left atrium. So when I'm saying pulmonary capillary wedge pressure, pulmonary capillary wedge pressure, pulmonary capillary wedge pressure, what I mean is the pressure which is in the left atrium. How much pressure is backing up into the lungs? Don't forget that the left atrium receives blood from the lungs, oxygenated blood, and then it will open up into the left ventricle, and the left ventricle will pump it to the rest of the body, right? So if the pressure in the left atrium is high, that means the blood is going to back up and it's going to affect the pressure in the lungs. And that is why the patients will develop pulmonary edema. Well, there's a lot with the pathophysiology which will go into renin-angiotensin system and all those things, but I don't want to bore you with all that. So why pulmonary capillary wedge pressure is important? Why is it important? Especially in left-sided heart failure. So think about it, especially in left-sided heart failure. If the left ventricle cannot pump well, so think about it, left ventricle cannot pump well. There's blood is coming from the left side, the lung, it comes to the left atrium, and the valves will open so that the blood will go to the left ventricle, and the left ventricle will push the blood to the rest of the body. Now, just think about it. If you have a patient who has left ventricular issues, that would mean that pressure is building in the left ventricle. And if pressure is building in the left ventricle, that pressure is going to be transmitted into the left atrium. And if that pressure is transmitted into the left atrium, guess what is going to happen? Then pressure is also going to build in the lung through the pulmonary veins. And that is what is going to lead to pulmonary edema.